Why does age-related hearing loss happen? Have you ever wondered why some people struggle to hear as they get older? Age-related hearing loss, known as presbycusis, is a common condition that affects many individuals as they age. This type of hearing loss occurs due to gradual changes in the structures and functions of the inner ear and the pathways that carry sound signals to the brain. The primary reason behind this is the natural degeneration of essential components involved in hearing. These include sensory hair cells in the cochlea, auditory nerve fibers, and supporting structures like the cochlear stria vascularis and spiral ligament. As these components deteriorate, the ability to transmit sound signals diminishes, particularly impacting the ability to hear high-frequency sounds. Several biological processes contribute to this degeneration. Over time, there is an accumulation of damage to cochlear cells. This includes the loss of outer hair cells that help amplify sound and nerve cells that are responsible for transmitting signals to the brain. Unlike some animals, humans do not have the ability to regenerate these sensory cells, which means that any damage accumulates without repair. Aging also increases oxidative stress, which can damage mitochondrial DNA in cochlear cells. This impairment affects their function and survival. Additionally, chronic inflammation and reduced blood supply to the cochlea further contribute to cell dysfunction and death. As we age, our immune function declines, which weakens the ear's ability to clear out harmful substances, leading to even more damage. Multiple factors can influence how and when presbycusis develops. Genetic susceptibility plays a role, along with cumulative exposure to loud noises and certain medications that can harm hearing. Conditions like diabetes and lifestyle choices can also impact the severity of hearing loss. These factors interact with the aging process, potentially accelerating hearing loss. Typically, age-related hearing loss begins with difficulty hearing high-pitched sounds and understanding speech, especially in noisy environments. It usually affects both ears equally and progresses gradually over the years. In summary, presbycusis occurs because aging leads to progressive damage and loss of function in the cochlea and auditory nerves. This damage is driven by complex biological mechanisms, including cell degeneration, oxidative stress, inflammation, and a reduced ability to repair. While environmental and genetic factors can influence the process, the core cause remains the natural aging of the auditory system. Understanding these mechanisms is crucial for managing hearing loss, which often involves the use of hearing aids and other assistive devices, as the damage is irreversible. Regular hearing checkups and protecting your ears from excessive noise can help reduce additional risks.